One of the biggest fears that we can have is being awake whilst having an operation. In anaesthesia speak, we call that awareness or being aware. And I'm here to talk about that today. I want to first of all explain that it is incredibly rare. We estimate that it occurs about 1 in 19,000 anaesthetics. So that's about 0.005% of the time. And not all experiences of being awake or aware under anaesthesia are the same. Most of the time, it's painless. It's a brief, vague memory. And in 2/3 of the time, it's a vague memory just as you're drifting off to sleep or even as you're waking up, which is when your brain should be getting back to forming memories anyway. Which is why we encourage you, if you suspect you've had an episode of awareness, to go back and speak to your anaesthetist, because often they'll be able to reassure you that it was just you either going to sleep or waking up, and that you weren't actually under surgery at the time. There's also different risks of awareness with different surgeries. So some are associated with a higher rate of awareness. The most common one I hear about is when people are having a colonoscopy or a gastroscopy. And that's actually because they're not actually having a full general anaesthetic. And this is something I will often mention to my patients. They're having a twilight anaesthetic or some what we call sedation, not the full general anaesthetic. Because with those procedures, we're just looking with a telescope. We're not actually doing any operating, any cutting, if you like. There are lots of things that we do to prevent awareness. So during surgery, we are monitoring your vital signs, your heart rate, your blood pressure all the time. We expect that these would change if you were awake during your operation. And there's also special monitors that we can apply. So if you are particularly worried about awareness or being awake, then I encourage you to mention this to your anaesthetist before your surgery. You can find more information about anaesthetics and also about the differences between general anaesthesia and sedation on the ASA website, so please do have a look there, asa.org.au.